Hello, I'm Dr. Marla Shapiro. I'm a past president of the Menopause Society, and today we have a fascinating topic. We're going to be talking about delaying menopause, and we're going to be talking about that two different routes, either ovarian tissue freezing or medication. And to talk to us about this is Professor of Obstetrics and Gynecology and Reproductive Sciences, Director, Laboratory of Molecular Reproduction and Fertility Preservation at the Yale University School of Medicine. No one better than Dr. Kutluk Oktay to talk to us today. Welcome.
Thank you. Try saying my titles 3 times.
I can, you know what? There are so many more titles in there, but we took up our entire conversation. But
and
ladies,
my name, tongue twister.
Take my word for it. He's the real deal when it comes to this. He is definitely the king of reproductive sciences. So let's talk about menopause. We think about the average age of menopause for most women in North America is 51, 52, somewhere in and around there. Are there benefits to seeing menopause at 60 or later?
Right. There are actually about 10% of women who are lucky enough to experience menopause late, according to most women. And then studies have shown that they have numerous health benefits. They have lower risk of depression, bone loss, heart diseases, other vascular diseases, and dementia, and there's even evidence that women who have late menopause may live longer.
Absolutely fascinating. So the question is, can you delay menopause? Is there science around that can help us delay menopause?
Right. So we've developed in the last 25 years a method called ovarian freezing and later transplantation for cancer patients who would normally lose their fertility because of damaging cancer treatments. So the procedures became so successful that now we're taking this technology and applying to healthy women who are concerned about the effects of menopause and some with strong family history of menopause problems. And our calculations, estimations, and studies show that this is quite possible.
It's astounding, really, to think about it. So by removing part of the ovarian tissue and freezing it, and I imagine there's a very highly specific way that it's frozen, and then putting it back, it actually will translate into added years of not being menopausal, and all those diseases that we see associated with loss of estrogen, you mentioned so many of them, then are further delayed. It makes perfect sense. So how would a woman be selected? How do you select somebody for the procedure? You certainly talked about cancer patients, and that makes perfect sense. But is this ready for prime time in terms of the general population, if you will?
Right. So, by the way, women have all the eggs they can have at birth, and they're born with 1,000,000 eggs. They only use 500 to ovulate. So 99.9% are wasted.
Right.
So ovarian freezing is trying to use that reserve, the reserve of eggs that would normally be wasted, and the eggs that are present during younger ages are also better performers. So the idea is that freeze those eggs before they're wasted and when they're high performers, and then preserve them with a sophisticated freezing method and use them just before menopause. And that requires a keyhole surgery, an outpatient procedure, using like 3 punctures, small incisions, the same day procedure. The tissue can be taken out and could be put back in the same way. Even we've developed techniques. These tissues can be put under the skin of the patient, and we've shown that they'll produce hormones in a similar way if they're only interested in hormone production, and which can be done in the office, by the way, under local anesthesia even. So the procedure has become less and less invasive, but we didn't know how well it would perform in healthy patients. So we've taken all the information we gathered from cancer patients and the laboratory studies, and we got 2 smart mathematicians. We said, take this data, turn this into a formula. And they turned this in a formula. That's on our website, fertilitypreservation.org. And a woman can enter their age, amount of tissue to remove, and then the procedure has different efficiency depending on who does it, and over time the efficiency improves. So you put that efficiency factor in there, like what percentage of the eggs survive. And then also we found that from this formula that you don't have to transplant everything once. If you do them in multiple fractions, it actually lasts longer. So you put that in there too. And in most women who do this early enough, we prefer that they do it before 35, definitely before 40. But there are women, the formula takes into account if you have egg reserve comparable, you're 40, but your egg reserve is comparable to a 35-year-old, that takes into an account too. So we take all that information into account in the formula and use that. And, we do the counseling together. We also look at the reasons behind the desire. A lot of my patients want to do it because their mothers experience severe complications of menopause, but they have high risk. They're already high risk for menopause complications. And so we select patients very carefully and based on the most available scientific data. But there are still, of course, it's new for this indication. It's been 25 years for medical indications. We are still accumulating data, even though we are freezing tissue from healthy women.
So if we look at moving away from surgery and we look to medication, oral medication or injectable medication, is there that on the horizon, a medication that could be used to delay menopause?
Yes, so I can see that this is potentially happening within the next 10 years. In my research laboratory, we have identified the compounds, the drugs that actually delay the loss of eggs from human ovarian tissue in laboratory conditions. We have identified drugs that are already FDA approved for other indications, and we're thinking of starting trials with these medications, which may also have other health benefits. And there are a couple of other drugs that may be in trials for the same purpose. So I see this decade as a decade for, saying bye-bye to menopause, hopefully, but at least menopause doesn't have to be a destiny for those women who have reasons or who are interested in delaying. There should be approaches to that. And after all, we're living longer and longer. Women are living longer and longer, but we haven't made a dent in the age of menopause. I think it's time that at least we proportionally delay that.
It's fascinating science, and certainly we'll be following this from year to year and have you back to have the further conversation. It really is so interesting that it started with cancer patients with preservation of really the fertility, and now we're really talking about delaying menopause and the issues that are at risk with estrogen deficiency. Thank you so much for joining us today.